This video is to be used supplemental to departmental standard works, instructions for use by manufacturers, departmental and organizational policies, and AORN guidelines. Project objectives are to standardize OR turnovers in an effort to increase compliance to regulatory and recommended guidelines. After viewing this video, reviewing standard work and demonstration, staff will be able to do the following. Verbalize step of an OR turnover, demonstrate an OR turnover, and verbalize and locate resources related to OR turnovers. An overhead page for turnover help should be called when dressings are going on the patient. This will allow time for cleaning supplies to be gathered at the OR doors until the patient leaves the room. No environmental cleaning, including trash and contaminated laundry removal, should begin until the patient has left the OR suite. Universal precautions should be followed at all times when potential exposure to body fluids or contaminated items. Perform hand hygiene. Please note, if isolation caddy is hanging outside of the room, isolation precautions should be followed. PPE precautions will be listed on door, in the care of the isolation patient standard work, or on the infection prevention website. Remove leftover sterile supplies left in the OR suite and return to sterile room. Don your PPE. If a chemo case has happened in the room, please refer to care of the HIPEC patient on the perioperative services website page or in the chemo armoire. If chemo case, don impervious gown, eye protection, and nitrile gloves. Yellow and black bins should be available outside the OR suite. Prepare washcloths or hospital-approved cleaning wipes for cleaning and disinfection. During turnover process, wipes and cloths are to be exchanged as they become soiled. Begin by cleaning equipment and furniture at perimeter of the room in a clockwise direction, working around the perimeter and towards the center. Clean all equipment attached to the walls, including video monitors, PACS monitors, and whiteboards. Furniture can be pushed to the wall when clean. Specialty equipment, furniture, and positioning devices should be wiped clean with approved solution, paying special attention to surfaces that face the surgical field with the highest risk for splash. If not needed for the following case, move to the hallway or put away in proper place. Clean and disinfect all equipment, Mayo stands, back tables, ring stands, kick buckets, prep tables. Cleans tops, sides, lower shelves, and base. Wipe down all furniture top to bottom, including legs and wheels. Dwell or kill time is listed on cleaning product. Current cleaning product for our facilities has a 5-minute dwell time. Please make sure the surfaces stay wet with cleaning product for the 5 minutes. Do not dry them off prior to the 5 minutes being complete. Don't forget to wipe down foot pedals and cords for the OR equipment. Empty linen, trash, kick bucket, sponge tree bags, and place in the center of the room along with dirty suction canisters. All clean room equipment should be placed on a clean surface or returned to the proper storage area. Clean equipment is not to be placed on the floors. Floors in the perioperative practice setting should be considered contaminated at all times. Safety straps, sequential tubings, and arm boards should not be placed on the floor once cleaned. They may be placed on pedestal of cleaned bed, but please use caution. We have had multiple bed breaks due to equipment getting caught in the lowering or raising of the beds. Clean OR lights, all sides, and booms. Cleaning the OR bed, including the tops, sides, and underside of mattress pad. Wipe all hard X-ray boards under the mattress pad. Clean pedestal and base of OR table. You may need to raise the OR table to fully clean the pedestal. Assess the integrity of your mattresses, padding, and etc. If integrity is compromised, pull out of service and replace with stock. Report any issues to the day coordinators. All safety straps and equipment should be cleaned and placed on clean equipment, not on the floor. Bed should be unlocked so it can be moved for dry and wet mopping. Dry mop, working from the perimeter to the OR bed. Cleaning should progress from the cleanest to the dirtiest areas of the floor. Floor surfaces at the perimeter of the room should be disinfected before floor surfaces in the center of the room. The center of the room, where the majority of the patient care occurs, is most likely to have higher levels of contamination. Starting on the perimeter of the room, mop the floor working from the walls towards the center of the room, the OR bed. Mop around the table, unlock the bed, move the bed and mop under it, reposition the bed, and relock when completed. Remove garbage bags, linen bags, and suction canisters from room. Make sure all cleaning wipes and washcloths are placed in the appropriate bag before tying clothes. Place dirty mop head in linen bag. Double check to tie close all of your bags tightly and close caps tightly to prevent. Linen and garbage bags can then be taken to the dirty utility room and placed in appropriate containers. When removing your PPE, remember it should be placed in the previous case's bags. Do not place dirty gloves and dirty linen in your next case's linen and garbage bags. Perform hand hygiene. Set up OR table with clean linens, pillow foam headrest, and draw sheet. Do not reset the OR suite, bed, or anesthesia cart with the gloves you used to clean the room. Done making the bed, please make sure it is locked and in the correct position and that the safety strap has been replaced on the bed rails. Please replace all linen bags and garbage bags in all receptacles. Replace suction canister, suction tube, and suction tip. In the absence of an anesthesia aid, dispose of the ventilation circuit. Clean blood pressure cuff and cord, pulse oximeter, and EKG leads, and coil and place back on anesthesia machine. Remove towel from med cart and wipe all surfaces of anesthesia cart and back table. Empty garbage. Remove gloves and perform hand hygiene. Please double check that suction canister, tubing, and suction tip have been replaced. Safety first. This is an airway issue and it's always airway, airway, airway.